Good evening. Thank you for watching. Thank you for being with us. Our current affairs program on a Friday evening in English. I'm Leah Hogg, live from Net Studios. My guest this week is a pioneer in infertility in IVF. He also has championed natural birth, and I would say he's also a pioneer in private medicine and a group of private hospitals. I would say he was the first. Dr. Josie Muscat is here with me. I thank you very much for joining us today.
Thank you very much for inviting.
I'd like to address what people are asking about today, the COVID-19 cases and the sharp increase that we're seeing. What are your views about that?
I mean, my views are what happens in this small island. I would describe it as an island of extremes. We're either blue or we are red. We are either angels or we are devils. And we always go to extremes somehow. Or we live in the same village, but I side with Santa Maria and the other one sides with St. Joseph. And we are enemies in a feast. So, I mean, we are an island of extremes. It seems that this island has no middle of the road. And I think this is what happened in the COVID-19. I think we went to extremes in the first phase where we managed to control, and we were very happy that we managed to sort of beat the virus, so to say. And we were very happy to say that we were the best in Europe. What happened was that we so much petrified the population that everybody thought that the virus was behind our doors, ready to catch up if we open the doors and go out. But at least that had an effect. What happened now is that we've gone to the other extreme. And all of a sudden we opened everything. We never thought that, we thought that this virus, we championed this virus, we overcame this virus. Well, I think the truth was not as it has happened to be. The virus was there. The health authorities were telling us that the virus is still here. For some reason or other, I mean, there was no heed of this. And what is happening today, everybody is seeing. And what is happening is that we sort of let go all what we were trying to contain. And now, all of a sudden, it seems to be running out of hand.
Yes.
As I was telling you, this is an island of extremes. It seems that we don't know where to strike the real balance, because, I mean, we have to understand also the political side of it. I mean, there's a health side where in the first phase, say of this epidemic got hold, and we managed to contain it. But then there was the second wave, where which was the economy of the island and the economy worldwide, which, I mean, we were saying that while we were containing the health problem, we were sort of going down the drain in the economic problem. So obviously every government has to strike a balance.
Mm-hmm. We saw that globally.
So we see, but what really happened is we didn't manage to strike this balance. So from one extreme, we went to the other. Mm-hmm. So now we are trying to sort of to see where this balance is. But as we are trying to do this, the virus is sort of taking its hold and again raising its head.
Yes, absolutely. I'd like to refer to the press conference by the Prime Minister this morning, where he said, I quote, that he cannot take the blame for the sudden increase in COVID-19 cases, as Malta cannot curtail tourism and the economy. Your views on that, that's exactly what you were saying. Do you think it's a leadership problem or a problem that's sort of collective with us as citizens of the island?
No, I tell you the truth. I mean, what I'm going to say happened in no part of the world. But I believe that this is a national problem. I mean, the COVID-19 is a national problem. It's not a politics. It's not a red or a blue or a green or an orange. This is all rubbish. This island is. But unfortunately, even in other countries, I think in a national disaster, let's say a disaster, or a national problem like this, where there are no colors, where there are no preferences, where I mean everybody is in the same boat, I think that both parties should have gone together, sat down on the table together, and struck a balance to see how instead of criticizing each other, and I would have done this, and I would have done that, and the people in the middle, you know, being involved in all this, because at the end of the day, it's the people who are going to suffer.
And it was and is a national emergency.
Yes, but I mean, this thing, but even if you're, I don't want to criticize only Maltese politics, but in this, I think it's everywhere in the world. Where I know of no government, no oppositions, no parties, which sat down on the table together and say, this is a national problem, forget politics. This is a health problem, where health is involved, there's no politics. We never sat down on the table and say, let's sit together and see what is best for the nation. I think in this situation, everybody would have understood, because not red or blue and all these speak and all this, everybody would have understood that this is a national problem, and everybody would have sort of pulled the same rope for the national good in a health problem. This is a health problem. It's like education. Education knows politics, no bounds. I mean, it's not a moment of how do you say, doing trying to experiment. This is the word. It's not a moment of experimenting. I mean, if you see what happened since the beginning of this epidemic, we have been told so many things and then told another thing. Even the World Health Organization itself has been telling us first no masks, now masks, and nobody's saying, some saying this does not make sense. Other people, I mean, why can't we sit down on the table? Why can't governments in a national situation like this, in a worldwide situation, it's not a national, it's a worldwide situation, sit down around the table, forget politics for once, and see what is really in the national interest.
Yes, it's obviously a new, and people are learning as they go along, including professionals.
People are suffering as they go along, and they are getting worse financially, and even, I mean, psychologically and everything.
Absolutely. Can I ask your opinion as a medical professional about testing? How does one approach testing? If you're perfectly healthy and you feel perfectly fine, should you really be going out of your way and
No, I think so. If I'm healthy, I feel nothing. Absolutely. If I go testing, I'm taking somebody else's place who could be really has necessity of being tested. In fact, now, I mean, once the second, let's say the second wave, if we want to call it a wave. But now that the second wave seems to be getting hold of us again, everybody's panicking now, and everybody's going to get tested. And now, obviously, everybody wants to have the result here and there. But it's becoming overwhelming now. So I think, no, if you feel very healthy, why it should be tested? But if I feel symptoms, which they tell us, if you have symptoms, go and test yourself, then yes. But I mean, if I am healthy and I go to test myself, I'm just taking other people's place and time, which probably they might have a reason why to go, while I don't have a reason why to go. Why be selfish, so to say?
Absolutely.
But this is what you're saying is all lack of education, all lack of trying to, teach the people that they don't need to panic. It's not a situation where we have to panic, but where we have to cooperate and help each other and understand what's happening and what precautions we have to take, not to injure ourselves or to injure others.
May I take a few moments to speak about the vulnerable groups, the people who are perhaps very obese or diabetic, or people, we class them as over the age of 65. How should they conduct their lives now that we're having the second peak and everyone seems to be panicking again?
No, first of all, let's put it in a bit of a different scenario. First of all, this virus is a very strange virus. We know almost, now we're trying to understand this, even till today, we are trying to understand the patterns in different types of, in different positions in the world, sites in the world, to see how it's behaving. So we are, even although it has been with us now since March, so to say, when it started in China, still we don't really understand the pattern, because it's a very strange pattern. I mean, it's not the influenza season, nowhere. I mean, so we don't know what's going to happen when the real influenza season comes along, which is December, around about December. Secondly, we know that it's a very strange virus. It's behaving in a very strange manner. We don't have any cure for it, and we don't have any prevention for it. That's the truth. The only prevention we have is to keep distances, masks, not to go where there are a lot of people, because there is the tendency, as happened now, where this virus thrives and can spread and does its effect. But what we know is that this virus, now we have enough of evidence, although it can affect young children, but it doesn't do any harm. It affects young people, but it doesn't do really any harm. But it affects older people, and most of the cases, those are the vulnerable people. So the vulnerable people are the age, which you mentioned, over 55 usually. The more you go, the higher up you go, the more you're exposed to complications of this virus. And when we say the vulnerable, it means that people who have, we call them comorbidities, a very difficult word, a medical word, but it means you have other conditions which make your immune system very vulnerable to any disease. So, I mean, if I'm vulnerable to any other disease, I'm vulnerable to this virus. So if I have heart problems, if I have asthma, if I smoke, and my lungs are all fibrous, so I am much more prone to complications for this virus than a healthy young girl or a young man or a child. So what is really affecting, what we have to really, guard and take very, very strict measures is where there are old people, like old people's homes, and where are these people with comorbidities, like hospitals or homes. You know what I mean? But the others, I mean, okay, the others have to be careful. But if they get it, their chance of having complications is very low.
Yes. Precautions are being taken again in homes for the elderly again.
That's good.
Which is a good move,
That's good, because those are the people who are really vulnerable. And if we see what is going abroad, which hasn't happened yet in Malta, the people who really are being affected and die are people who are there in homes or in hospitals. I mean, the vulnerable, those are the people who we call vulnerable.
Absolutely. We had a program.
And I think that which I was saying, because nobody mentions it, nobody gives any importance to the immune system of the individual. So you hear a lot of things, but nobody is telling people how to take care of their immune system, which at the end of the day is the greatest protection against this virus. It's your immunity. And that's why people with comorbidities, with vulnerable people, are very prone for infections, because their immune system is very low. And these are where the virus thrives and, thrives and causes these side effects. Mm-hmm. And that I've never heard anybody speaking telling people or telling them what to do to improve and increase and strengthen their immune system, because the immune system is our army against this enemy.
That could be boosted always through a good diet. I mean, that's the
very basic. You've got good diet, you've got zinc, you've got calcium, you've got combinations of tablets.
Yes.
I mean, then for vulnerable people, there are combinations of injections which you can take to strengthen your immune system, but nobody talks about these things.
No, I do understand that. We had this type of program last week because obviously the sharp rise started appearing last week, and we've had quite a number of comments and questions from our viewers wishing us to address the COVID-19 cases within the community, the migrant community. Could you perhaps either put people's minds at rest, because there is quite a lot of concern
about
the migrant community, the increase in the migrant community, the cases?
Yes, I mean, I mean, but the cases we have are not all brought about by the migrant community.
No, absolutely not.
You've got the migrant community, you've got the local community, and then you have the people who are coming from abroad from different countries. All these together are bringing our problems. It is true that in the last influx of migrants that we had a large number of people who were positive. Yes, that is a problem, but I mean, luckily, those people are tested as soon as they arrive. If they are positive, they put them in quarantine. The problem is also those people who are infected but do not show at the time the test is done that they are positive. So I mean, if they are not put in a quarantine also, and they come in contact with other people, they may transmit it. But I mean, let's not blame only the migrants.
No, absolutely
I mean, it's a whole. It's a national problem.
The migrant situation is being contained within the community.
That's what I mean.
It is being contained. May I just switch to the long-drawn scandal of Vitals Global and Steward Healthcare and the irregularities in the contract. In your opinion, should this contract be null and void, seeing that there was no due diligence?
If there is a person besides government who suffered out of Vitals, it's me. Because when Vitals came, this man, Tumuri, met me and he wanted to buy Kapwa Hospital. I mean, Zaytun was not open as yet. He wanted to buy Kasbah. And I know what I passed through this fraudist man. He's a big fraud. I mean, the way he talks, he convinces you that he knows everything about health. The way he was talking, I think he must have done a big research on me, the way I talk and the way I think about the private health sector, because he was talking to me about his plans and I was saying, but what he's saying is exactly what I would wish to see, how I would wish to see the health sector develop in Malta. And I mean, yes, I fell prey to this fraudist. But the truth is that after a year, 2 years almost, of negotiations, he never put one single cent on the table. Unfortunately, I was being given advice to give him a chance because it's difficult to get money out of America and all this. And I was all the time believing all this until one day he made a proposal which I said, this man is playing me about. But I mean, the damage that this man caused to our hospital financially and even family-wise, what he caused, the problems he caused me family-wise are huge problems. But that is only me. But now, what is coming out of how things were negotiated, I mean, first of all, I'm disgusted and I'm hurt as a Maltese, the way we Maltese are treated and the way these foreigners were treated. Fortunately, I'm talking about people who today have been chucked out of politics, fortunately. But what is coming out today is more than scandalous. And yes, I would be the first one to praise and say thank you to the Prime Minister if he were to get these people back to Malta and make them pay for every single cent which they spent and they took in their pockets to build their villas in Switzerland.
There are means and ways of repatriating money, but should the contract, do you think, be made null and void?
Today before tomorrow.
Okay, thank you.
I think here in Malta, I'm not saying for me, but I think in Malta we showed that we have capable people of running the health system. We always boast that we have that's not the best, but one of the best systems in the world. Even when it comes to the National Health Organization, we are foremost in health, fortunately. So yes, we were capable, and I believe that we don't need these fraudists and these people to run our hospitals. Yes. I believe that government has enough good people like Mater Dei to run their hospitals as they should be run.
Enough talent yourself. And finally, the time passes very, very quickly. As a seasoned politician yourself,
I'm no longer a politician.
But you have a lot of experience. Can we just finish off by addressing the leadership contest between the leadership in the Nationalist Party? How do you think things are taking shape now?
No, for me, who dedicated my life for the whole almost 30 years in politics. About 30 years ago, I was in politics for 30 years, and I was in the Nationalist Party, and I was very active in the Nationalist Party. For me, what's happening is it hurts me, how it probably hurts all people who really have the Nationalist Party at heart. And my plea, honest plea, as a Maltese, because it's a disaster not to have an opposition, and a strong opposition even for the nation as a whole, and even for the Nationalist Party, which had such a glorious and nice history. I plea to the people who matter to sit around the table and reach an agreement for the good of the party and the nation.
Thank you very much, Dr. Muscat. Thank you for your time today. It's been a pleasure. I am with Dr. Josie Muscat. We're having a short commercial break, and I'll be with you very soon.